The reason I wanted to get a genetic test was because I do have breast cancer in my family history from my mom's mom. So I know that that's kind of there. It's possible that I could get it passed down to me as well.
I believe that knowledge is power, and certainly the ability to identify genetic mutations that increase a person's risk of certain cancers revolutionized cancer screening and oncology, and what can be done to prevent cancer.
Genetic testing is something that's becoming a lot more accessible over time. We're seeing a lot of patients who have an interest in the test, have heard about the testing, and are requesting that even from their providers.
Half the patients we see are diagnosed already, and they're doing this for information for themselves and treatment, potentially for their family as well. But we are starting to see a lot more younger patients that are doing this. Even sometimes for family planning, this can be helpful information to have.
I've lived in Chicago about 3 years and worked at Rush the entire time. I work in the marketing department now, so I do the analytics for the team based on our results and then also informing the team of what's happening on the hospital side. The process started with me scheduling the appointment with the genetic counselor.
Our goal with genetic testing is to be proactive and preventive. We start off by asking questions about who has had cancer in the family, what types of cancers those individuals have had and at what ages, and also a little bit about Tori herself. And then together we talked more about the test itself, what genetic testing can tell us, how that can be a piece of the puzzle in a patient's whole screening and management.
After the appointment, that can be done with either a blood sample, or sometimes we can also do saliva samples or cheek swabs. It takes about 3 weeks for your genetic test results to come back. One of the genetic counselors or genetic counselor will give you a call, and they'll go over the results with you, what it means for you, what it means for your family, and follow-up steps if there's any specialties that can follow up with your care and screenings that are needed.
Tori was found to have a PMS2 gene mutation, which really just means that she was born with a risk for cancer. She was born with a genetic mutation. The PMS2 gene is associated with a condition called Lynch syndrome, which increases her risk for primarily colon cancer and uterine cancer, but not quite as high as other forms of this condition. The biggest change to her care is going to be to start colonoscopy screening for colon cancer at a younger age, at age 30. And she'll be doing that screening a little bit more frequently than the average person would. Patients who have Lynch syndrome tend to grow polyps in the colons that can become cancerous more quickly than for the average person.
I would have waited to get a colorectal screening or uterine cancer screening or whatever it be when it was recommended and not early. By that point, it might have been too late. So I think having this knowledge too, to be able to get it early, is potentially life-saving. This whole process has definitely empowered me to talk to friends, family, cousins. It's made me thankful that I can help my family sort of be smarter about their health decisions.